Okay, hello everybody. I am back. I hope you guys had a wonderful weekend. So I wanted to talk about some of the diagnosis. So if you want to check and see if your child is one of the children that we've been talking about who have those huge emotions and they experience emotion dysregulation, some of the mental health disorders that can come about, that emotion dysregulation can be a symptom of, is anxiety disorders, eating disorders, depressive disorders, bipolar disorder, post-traumatic stress disorder, borderline personality disorder, substance use disorder, oppositional defiant disorder, alcohol use disorder, and disruptive mood dysregulation behavior. Disruptive mood dysregulation disorder. Now, the personality disorders, psychiatrists and therapists do not like to label children with personality disorders, and so you will not see that personality disorder diagnosed much in children or anybody, let's say, below the age of 18. And it's just a rule of thumb. It is best practice not to diagnose children with borderline personality disorders and things like that. But those are some of the diagnoses that your child can get if they're experiencing, these emotion dysregulations and different things like that. Obviously, some of the most challenging ones to deal with is the oppositional defiant disorder and the disruptive mood dysregulatory disorder. And so those are things to kind of pay attention to and notice, what is the diagnosis that has been given to your child. And if the psychiatrist, because therapists cannot prescribe medication, so it would have to be a psychiatrist. And so if the psychiatrist is referring you or recommending some form of medication, it's really important to talk to them about what the diagnosis is, what medication they're getting, and what that medication is expected to do. But you can always also talk to a therapist and they can kind of look it up for you, but they can't be the one that prescribes medication. So look for these diagnoses and see if your child has one of these diagnoses. If your child is showing a lot of emotion dysregulation, these kind of just high out there in your face kind of behavior, they're destroying property, they're yelling, they're very verbally or physically aggressive and different things like that, it might be time to go and get them an evaluation.